Hello, this is Clean Coach Carly. I'm the staff nutritionist for Healthy Habits Living, and I'm talking today about birth control. So usually I'm talking about supplements, but this birth control are usually prescribed medications or things that you buy over the counter. So it's not really supplements at all. But it's an important topic, especially for women, but also their partners as well. So here are some short-term options for birth control. And maybe some of these you don't know about, and maybe you know about some of them. So of course there's abstinence, okay? And then there's the pill, the birth control pill. And I'll talk about that in length. There's a patch, there's an arm implant, there's the vaginal ring, there's condoms, there's the 3-month shot, which is different than the arm implant. There's the pull-out method, and there's various vaginal sponges with spermicide. Now, I am big into women's lib as a woman, and I think that women should have choices about their bodies. But I also think they should have informed choices, and that is where I believe that we're really falling down in our healthcare. We as women are not advocating for more education and more knowledge before we do things like take a birth control pill. So most women and men know birth control or the most reliable birth control to be the pill. Now, the pill is actually the name for a lot of different pills. They fall into 2 categories. The first category is pills with false progesterone called progestin. And then the other type of birth control pills actually release a combination of hormones. The hormones, whether it's progestin or a combination of hormones, are supposed to trick or alter your hormones in a way that your body does not ovulate and it thinks you're pregnant. Now, this is very effective at not allowing you to get pregnant. In fact, it's 99% effective if you take the pill at the same time every day and you take it consistently. But it's also effective at changing your hormones in a way that confuses your body. Now, Dr. Jolene Brighten is one of the leading experts on something called post-birth control pill syndrome. This is illness and inflammation and infertility that happens after taking birth control. In fact, there's been lots of studies over the past decade or so that link the use of birth control with a lot of scary health problems. So a couple of those are increased yeast infections, which are uncomfortable to say the least, mood disorders, increased risk of breast cancer, cervical cancer, liver cancer, and uterine cancers. Now that's the most concerning. Also, low or hypothyroidism after using birth control pills, increased risk of stroke and blood clots, nutrient depletions, including important B vitamins. So I'm not a proponent of changing your hormones, especially using false hormones during your childbearing years. I am a proponent of using bioidentical hormones as needed, and that's usually premenopausal, postmenopausal women. So here are some other options that you might run into if you are looking for more natural forms of birth control. Now, there are 2 types of IUDs, and IUDs are intrauterine devices. So these are very small, usually copper inserts that are put into your uterus. They're about the size of a toothpick. Now, those are great, and they've been around for a really long time, and they have great success rates. However, there's a newer version of these IUDs that actually release or emit hormones. I'm not a fan of those. That would be the Mirena, the Kyleena, the Lolita, and the Skyla. Now, all of those are IUDs, but they also release hormones. I don't recommend those for the same reason that I don't recommend the birth control pill. This is altering your hormones in a way that tricks your body into thinking that it's pregnant because of hormone levels. And this can have lasting effects on your fertility as well as the other health concerns that I mentioned. There is one type of IUD that does not emit hormones, and that is just called a copper IUD. And it can be implanted and used for up to 15 years, and it is 99% effective. And it is even more effective than the morning after pill. The side effects or the downfall maybe of the copper IUD is that there can be heavy bleeding for 3 to 6 months after the insertion. However, most people don't have that problem. And they also, of course, aren't going to get any of the post-birth control or post-hormone usage problems that can be associated with those hormone-emitting IUDs or hormone-based birth control pills. So I don't recommend those hormone-based birth controls, but I do recommend the copper IUD. If you want more information about post-birth control syndrome, you can look up Jolene Brighten. She has a great book and website about that issue. And if you're looking for other natural forms of birth control, you can check out her website or the rest of this blog. Here at Healthy Habits Living, we are always here to give you the most up-to-date and thorough health information so that you can optimize your health. We're here to help you get healthy so you can be healthy and stay healthy.